Hello everyone, I'm Goong-gumi, a Korean pharmacist. In my last episode, I introduced various kinds of OTC products for skincare that can be bought in Korean pharmacies. Today, I'm going to show you most famous products in Korean pharmacies can use to treat acne. Be sure that this treatment is based on Korean pharmacies' OTC medicines, so it may differ from other countries' OTC medicines. First, we need to know what acne is. This is what your healthy hair follicle looks like inside your skin. Hair follicle is a tube-like pore from which your hair grows out of. Sebaceous glands are also in your hair follicles, and sebum is secreted from these glands. Sebum is an oily substance that helps your skin from drying out, such as stress, hormones, smoking, and genetics can affect sebaceous glands to secrete too much oil, thus leading to acne. If the skin pore is clogged due to a buildup of dead skin cells, leftover makeup, or dirt, this too leads to acne as well. Acne is developed from sebum and clogged pores. If this clogged pore is infected by bacteria, this triggers the inflammation of hair follicles. When this clogged hair follicle or clogged pore with bacteria, oil, and dead skin cells gets swollen up, it is called komodo. Komodo trapped under the thin layer of skin has a whitish or yellowish head, so this is called whitehead or closed komodo. Without the skin layer covering the top, open komodo shows black color due to the oxidation of the sebum by air or skin pigment. Because of this black color top, open komodo is also called blackhead. Blackheads can be removed by using pore strips, but whiteheads are relatively more resistant to the pressure, so it is hard to remove whiteheads with pore strips. With the blackheads and whiteheads remaining in the skin, follicular walls may break down as time passes due to the inflammation. Then the lesion becomes red, and white blood cells gather around this lesion to fight bacteria, and small bumps are formed under the skin surface. This is called papule. Papules tend to be solid, swollen, and appear red on the skin. Most papules eventually progress to pustules. Pustule has whitish or yellowish head on the blemish due to the pus formed by dead white blood cells and bacteria. If it gets worse, papules and pustules then progress to nodules and cysts. At this stage, hair follicles are ruptured and the infection gets deeper in the skin. Nodules are the bumps that are rather firmer to the touch than cysts and show red color. Cysts, on the other hand, are softer because they are filled with pus and show red with faint purple or brown color. Nodules and cysts take few weeks to heal, and because they tend to stay in the deeper layers of the skin, it's usually very painful and cause scarring on the skin in the end. As acne progresses from mild to severe ones, treatments for acne differs too. Blackheads and whiteheads do not accompany inflammation, so they can be treated simply with salicylic acid or benzoyl peroxide. But when they progress to papules or pustules, you might have to use antibiotics as well. If they become nodules and cysts, you better seek a dermatologist.
Next time on Goong-gumi's pharmacy story, Goong-gumi is going to introduce actual OTC medicines that you should have for your acne care. OTC medicines to treat mild to severe acne, hydrocolloid bandages to cover acne wounds, ointments to heal acne wounds, and even gels you can use to get rid of acne scars.
That's it for today. If you have more questions or things you want to learn more about, feel free to leave a comment. Bye! 안녕!